Briggs from Arizona.
Thank you. Thank you, Representative Mervan and Ranking Member Bost, and I thank Chairman Takano as well. I recently introduced the Veterans Healthcare Freedom Act and request that the committee support and advance the bill. 7 years ago, it was discovered that more than 40 veterans had died while waiting for healthcare from the Carl T. Hayden Veterans Administration Medical Center in Phoenix. Unfortunately, this problem was not just in Phoenix, and veterans from around the nation began revealing the horrendous conditions and wait times they faced at their local VAs. Our veterans were forced into a healthcare system that did not meet their physical or mental health needs. Upon hearing this, Congress acted, and in 2018, President Trump signed the Bipartisan Va Mission Act into law. That legislation was designed to expand access and improve the quality of care for veterans. While we've seen marked improvements, there are still significant problems. According to one newspaper account, in Georgia, between September 2020 and early May of 2021, more than 12,000 veterans had to wait more than 30 days for a response from the Atlanta VA healthcare system. And that does not include 6,000 that were already waiting prior to September. One veteran in Georgia had to wait 3 months to get a pair of eyeglasses that he broke during the pandemic. He had to drive 170 miles both ways, total round trip. And after being examined by a doctor, still had to wait for 3 months to get his glasses in the mail. In Phoenix, a veteran who had been seeking help from the local VA ended up taking his life. Earlier this year, the entire Massachusetts congressional delegation wrote to VA Secretary McDonough to protest, quote, reports of veterans being asked to travel to Connecticut, New Hampshire, and Rhode Island for appointments, including a veteran with multiple sclerosis who had to drive 220 miles round trip in a blizzard to an appointment in Connecticut, close quote. These are just a few examples of the challenges our veterans continue to face. In 2014, Congress passed the Veterans Access, Choice, and Accountability Act. This legislation created the Commission on Care to examine veterans' access to health care and to make recommendations on how to improve the VA. In 2016, this commission presented its report to the Obama-Biden administration and made several recommendations, including allowing veterans to have greater access to community care. The Veterans Healthcare Freedom Act, the legislation I have introduced, would create a 3-year pilot program that would improve veterans' ability to access healthcare in the free market. Currently, veterans must receive approval from the Department of Veteran Affairs before they can receive community care. My legislation would simplify that so that veterans only needed to receive approval from their primary care physician. Veterans would be able to access primary, specialty, and mental health care outside of their corresponding veteran integrated service network and at non-VA facilities. Veterans would be free to choose any primary care doctor in the covered care system or have a specialist designated as their primary care doctor. Veterans needing mental health services would be able to choose their own mental health care provider. By eliminating bureaucratic red tape and allowing veterans to go straight to their doctor for care, we can ensure that no veteran dies waiting for care. This legislation is the best way to ensure that veterans are able to gain access to quality health care in a timely manner. Our brave men and women of the armed forces have answered our nation's call and put their lives on the line to defend us from those who seek to take our freedoms. From Normandy to Vietnam to the Middle East, they have exemplified the best of America. They have fought for us, and now it's time for us to fight for them and ensure that they have access to the care they need, they want, and they deserve. Thank you for allowing me to take a few minutes to testify today. I hope this committee will begin consideration of the Veterans Healthcare Freedom Act. Thank you so much, and I yield my time.